All right, and you always want to keep your hands on people. All right, up and down. That's good. And you make sure they're hurting. Anything that causes pain in the leg, you stop right away. Anything that causes pain in the back, you stop it right away and you ask me. The leg pain, automatically you stop. Okay, so that's the bridge, right? The curl up. How you do the sit up? It's very important. Okay, that you feel for the tension in the abdominal muscle. And what they want to do now is straighten out one leg. Okay, and the idea is to lift the chin up, looking at the ceiling. So the head is looking up at the ceiling. That's what we do. Okay, good. All right. So now we're not bending the neck. We never bend the neck. Now, if they want to hold their neck, if they have a stiffness in the neck, they can protect their head. But again, the elbows stay back. Don't bend your neck. That's why it's good to see how the head comes straight up. So all we're doing. If you come too far up, you're going to recruit the psoas. And what you can do is switch legs, right? So we always start out with 5 repetitions, and then we work up to 10 repetitions, and then we work. You should be writing this. And then we work up to 15 repetitions. Okay? Write down everything I say, because you're all going to get tested on this. Okay? Next thing we're going to do is we're going to do the side plank. So lie on your side, and we're going to bend the knees, and we're going to put your arm here. This is the easy way to do it. You keep your hips and your head straight. Now lift up the hips.
My hips aren't straight.
Your hips got to stay
It
straight.
needs to be straight.
No. I'm saying some people, this is the easy way to start. If they have a hard time, then you can straighten the legs out. That's the idea, is to do it this way, right? Right?
No. Okay.
It's okay. No. See, what's wrong is your head is forward. You don't want to use the neck, because that hurts the neck. So the idea is you got to push them forward here, and you got to protect them here, you see? So keep your hands on these people. You shouldn't be standing and doing, again, if you have other patients, you can't always do this, but you want to make sure you do this, okay? Now, if you add instability, this is called a Bosu ball. So, elbow here, okay? Now, raise up, okay? Raise up. Again, make sure they're straight. You can add, make it harder when they do this, right? All right, now for the abs, also, sit up. Let me finish the magic 6. Let's just do that. I'm going to go these after. Now what's the next one?
Prone planks.
Is that in it? Yeah?
Yeah.
Okay,
That's part of
prone
it.
plank, okay. So we plank, we keep it straight. What most people do is they raise their hips up. That's called cheating, okay? So prone plank, that's a good thing to do. Now, this exercise you can add extension, which means raise your left leg up, raise your right leg up. Okay, you could put the bands around their ankle. You can add the extension for the gluteus muscle, right? You can add abduction, plank, abduction, out and out that way, okay? Good, and you can also do it on the Bosu ball. Plank. Makes it harder, right? Take your time. All right, so we plank. Make sure the head is straight, okay? That's good. Well, just neutral, that's good. All right, is that it? Is that the magic 6?
Cat camel.
Cat camel.
Cat camel.
Bird dog.
Cat camel. Go ahead. So cat camel. All right, or cat cow. So this is good because this is the easy one. We should really start with this one. So whatever I just said, always start with this one. This is the easy one, right? Right, and then bird dog. Do the bird dog. Okay. Bird dog. All right. This is alternate arm and leg, right? Now sometimes if they can't do that, just have them do the one, like just do the leg. No. Right? If they're old people, or just have them do the arm, right arm. All right? If they're old people. Now you can have them do this on the ball. Makes it hard. When you add the ball, unstable surface makes it harder. Okay? So you do that on the ball. Anything you do on a ball makes it harder. Okay? Now, for the back, let me have you get and sit here. We're going to do the V-sit. This is hard now. So now we're getting harder. Okay, so the V-sit is, do it. See how they're doing it, okay? So this means that you have to protect them here, because if you don't want them to fall and hit their head. All right?
Okay.
All right? V-sit. Let's do a oblique rotations. Get your legs straight. Maybe bring your knees up and switch, alternate. All right? And then you can alternate the knees.
Yep.
And if you get somebody who's really good, you put this here and you switch with the ball. You always want to stay behind them because if they fall, you got to take care of that, okay? Now, that's with the medicine ball pass, all right? Come over here. Then you can also do, obliques this way with this You know what I'm talking about?
Yeah.
So
Okay, this way.
bicycle.
Like a bicycle on the ball, right? Right? You can do that on a bicycle on the ball. Now, on the ball also for the core, you can have them practice on their knees. So get on your knees.
Okay.
You're gonna have them balance on their knees.
Drop something. Right there.
Oh, that's my bee food. Okay. So balance on the knees. And you can have them take the ball and push out different directions, right? Okay, that way. Good. Then on the ball you can have them do overhead passes. So that's higher. So the higher means it's harder, right? So all of this is good for the core training, right? All this is good for the core training. Alright, now line your back and put your feet on the ball. We could also do the bridges on the ball. I showed you that one. Lift up the hips. Now we can get a one-leg bridge is harder, you see? One-leg bridge is harder. So we use the ball at the end when they get really good at this, okay? So those are the big back exercises. I may have forgotten a few. All right, now you guys need to sit up and stand over here. We're going to do the hip. Let's do the hip, okay? So with the hip, let's have you face that way.
Sorry.
So lie with your right side, left side up. Okay, so we're going to do. You can put the. I'm going to make believe they have a band around their ankles now. The band, right? To make it harder, but we start out without the band. With exercise, it's always good to start out with 5 repetitions, and you work up to 15 or 20, and you get 1 or 2 sets. Okay, 2 sets is better. Now with the hip abduction, we raise the leg up and down. You keep the toe pointing straight or down. So the toe points down like this is better. What people like to do is they like to lean back. When they lean back, they're getting the groin muscle. That's cheating, okay? We're cheating. Now, a hip abduction. That's the gluteus medius. Now, if you move the leg forward, okay, if her leg was forward and she came up, that would be the gluteus minimus. So you can do the hip abduction with leg forward, hip abduction here. You got that? Did everybody see that? That's important to do.
Do you want to do both all the time?
Usually when I say abduction, just start with the medius, okay? Now let's have you on your stomach. On your stomach. Okay? We're going to do hip extension. So we're going to do the leg. Now this time, when she does it this way, we're going to activate the glute and the hamstring. Okay, now make sure you can have the bands around the ankle to make it harder, right? When we do this, we're going to raise the knee up. Now we're going to just get the glute because the hamstring is quiet. Okay, you're going to mostly just get the glute. Did you get that? Everybody sees that? All right, so that's the hip. Now, the other thing you do with your hip, lie on your back. You have, for the hip, you have the straight leg raise. All right? And then you have the soccer kick. The soccer kick, they toe out. That's for the hip flexor, the iliopsoas. Okay? The next one, what else did I forget?
Piriformis.
Piriformis. Sit over here. Yeah, that's it. But lying down, we got it now, right? For piriformis, the idea is to get, they can sit here and they can do the band this way. They can take the band, they can lock in their foot, and we're doing the piriformis to get the gluteus muscle, right? Piriformis is one. Now, if sometimes they need to do this one too. Okay? Sometimes they need to do the internal hip rotators, obturator, and those kind of muscles, all right?
Yep.
All right, so did everybody get that? Now, lie on your stomach. The knee. Let's talk about the knee. So the knee, you have the hamstring muscle. When you turn the foot in, this is the inner side. So you're going to strengthen the inner side of the leg. Semimembranosus, semitendinosus. When you turn the foot out and you bend the knee, then you're going to strengthen the biceps femoris, the lateral. Okay, so that's important. So sometimes people have an inner side weak, sometimes they have the outer side. But just for somebody neutral, you put the foot straight, like this, for just neutral, okay? That's for the knee, all right? Now they don't have to come all the way, they can come like this far. You put the bands around their ankle. Does everybody get that? Okay? Now, then for the knee, you want to have them sit over here. You have the muscles in the thigh. Usually the muscle that's weak is the inside one here. That's the vastus medialis. So it's important when they need to do that, you have the bands tied around, you straighten the leg and you point your toe out. And you keep the foot pointed this way. So the end point is that, you see? So she's going to activate this muscle here. All right? She's going to activate this muscle here. Also for the hips, I didn't show you the clam exercise, right? That's this one. You can do that on the side, or you put the bands around the end. That's called the clam. That's for the back and for the hip. That's the clam. Did everybody get that? And also for the back, Also for the back, come over here, please. Let's do rotations. We didn't do that. So for the back, we're gonna put this in her chest. Yeah, we're gonna do rotations. All right, so that's for rotation. Again, this one you don't want to do in the beginning because it hurts if they have a swelling here. And then you do side bends.
For the twisting, do you want hips facing forward or hips?
Hips are
traveling
facing
with you?
sideways. And
So
you-
hips don't move with the trunk.
That's a good question. Use your judgment. Sometimes that's a good question. Ask me. It depends on their problem.
Okay.
Yeah, for thoracic, if it's just the upper body, then you keep the hips stable. Okay, keep going. But if it's lower, if you want to get if you want to get the lower part, you can add the pelvis. That's a good question. Good. All right, now for the knee, that's good. Thank you. So I gave you that. For the knee, we can also do squats. Do squats. Start them against the wall, right? So you do wall squats. All right, so we're gonna do wall squats. Excuse me. Put your feet 6 inches from the wall. A little bit more. A little bit more. Always keep your knees and your feet and your hips aligned, shoulder width. Okay, you can point your toes out just a little bit. That's good. And now come down. That's it. You never want the knees to come forward over the feet. The knees should not be over the feet. Okay, now come off of that and do it by yourself. That's the second squat. You make sure like they're sitting down on the toilet. It's like they're trying to sit down. Then you do a lunge. Do a lunge. Okay, then we do lunges. Okay, and then here's another one. We can do this lunge. We can do a static lunge this way. This is very hard. You try to do 15 of those, I guarantee you tomorrow you can't walk. Do 15 on each side.
Don't do 15.
You won't be able to walk tomorrow. I did this the other day. Now, you can also do the lunge on the ball, please. You can do the lunges on the ball. And again, this is more advanced. All right, good. Let's see how the back is straight. Now get on here and do the squat, please. Squat. Always protect them. All right. Now, also, you can stand over there. You can do side stepping. Do the side stepping. Okay, so now they can do this again. If they're having trouble with their knees, and this is easy stuff, but still, that's good. Now, forward stepping. Go over it. Now, if they have foot pain or ankle pain, this is good. Okay. You got it? So that's the knee. Those are the big ones for the knee. Did I miss any? Tell me, Paulina. We got most. We got the hip. We got the back. All right. Now let's go.
The noodles.
Let's go to.
High rows, low rows.
Okay. Let's go to the neck, and then we'll go to the high rows and low rows. Where's the other foam thing? The foam.
Excuse me,
The regular foam.
that's one right here.
That's too big. The black one.
It's behind.
It's behind me.
Looking for this.
The black
Yeah.
one.
Here you go. So this is the head retraction. Okay. So you make sure this is very important. Chin tuck is. Your buttocks are against the wall, the tushy is against the wall, 4 to 6 inches from the wall. This is for somebody who has, this is the hard one. Put your buttocks against the wall. Now, take your chin and push it back. Now, you see how hard that is? That's actually too much, right? So maybe you want to use the other one over there. Give me that one.
The
The
pillow.
The
That
bigger
pillow.
one?
That pillow.
Oh.
All right, now there's guys in here, there's people in this office that are like this, that you just, okay, so this would be between the shoulders, chin tuck, okay? That's the push. So it's like it's not looking up. That's another exercise.
All
It's
right.
like, do you ever see ducks, Okay, you want to hold it for 10 seconds. 10 seconds. 10 seconds, okay? Now, if they're really bad, you just put them against the wall like that. You got it? That's important. The next thing we do is give me the band, please. We do the neck extension. So the idea is that they do it in one piece. Now watch how I do this. Ready? I'm going to pull up, right? So I look up and pull up. I look up and pull up. I'm trying to pull and look at the same time, okay? And if it's too easy, then they close closer here and they make it tighter. And if they want, they can double it. And if they double it, then it's, well, that's even more. You see what I'm talking about? But doubling is too much for some old people, okay?
Right.
So you can do the chin tuck, right? And the chin tuck and the head extensions. That's very important for them to do. Then with the neck, you want to use the side ones here. So we're going to go and do side bends this way, right? We can do either side. That's lateral bending. We could do forward bending for the neck. Again, you want to hold it, make sure they're not using their body. Turn this way. We can look up. We can do back extension. Look up. Okay? Then we can do rotation, where we're turning. And this is right here. So we have it. I put this here for a reason. Okay? You got it? Okay, did I do all of them?
Yes.
Okay, the next one is the shoulder blade. This is very important. Do the band, please, the red one. So this is important now. We're gonna do the shoulder blades. Now you want, the closer they stand to the wall, the easier it is. All right? So the first thing you do is you squeeze the shoulders.
Sorry.
Watch this. Pinch the shoulders, then do the exercise. Low rows, low row, pinch, pull. Ready? Pinch, pull. Okay? Now, they're not gonna do that perfect every time, but you wanna teach them the right way. Next one is high row. Okay, so now if they have a bad rotator cuff, then they're not gonna be able to do this because it's gonna hurt them. So you just drop them down a little bit, like 45, okay? So you start here, then you come here, then you come here. And they come to the chin, like high row. So it's kind of this. Don't come, yeah, you can do that. Okay, that's not too bad. So we're getting the higher row. Again, but make sure you start, pinch the shoulders, and do it. That's the right way to do it. That's the best way to do it, okay? Then we do the YTA. So we're gonna do YTA. So let's say these two. We're gonna start them out without weights. Now let's do it standing. That's a little bit more advanced we do on the ball. So YTA, ready? You're gonna start here. Here's the starting position. Hands, no. Palms are facing like that. So angle, like this. It's like this, see? So Y, T, A. So my palms are always in the same position. I'm not turning my hand. YTAs. You got that? YTAs. Now do them on the ball, please. You can also have the T be this way. So the T can be this way, or the T can be this way. It depends on what you're trying to accomplish, okay? Now, that's why, again, you gotta be, for certain people, that's too much, right? A. Now wait, when you do the backwards, okay, Y, T, good. Alright, that's good. A, that's good. Excellent.
Reverse
Okay.
flyers.
Do reverse flies. That means
Flyers.
out. Okay, now you can bring the elbows back like that. That's reverse flies. Ready? Good. Excellent. Not bad. Good. Now let's have you sit on the ball. For some people, like very old people or pregnant women, just sitting on the ball is enough. For some people, raising one leg straight is hard. You got to watch them, and you try to hold it up. Okay. For some people, just turn the body to the right, and turn the body to the left, and do the circles on the ball. You see what we're doing? Okay, this is all pelvic stuff. Now how about leaning forward and back? Like this. Okay? It's a little bit obscene, but that's okay. Alright, here we go. Alright, there you go. Now, what else do we want to do? Leaning back on the ball, slide forward. So stretch out the back. This is a good thing to do when they're tight. Notice, yeah, you want to protect their neck. See what I'm doing? Now, they can do this. Slide down a little bit now. Now, we can do hip raises. Up and down. See, we can hold on. We can do hip raises. You got it? That's a good hip raise exercise right there. You make them straighten out one leg, please. Straighten out one leg. Ah, now it's even harder, right? Try a hip raise. Okay,
Hip raise?
that's good. See, that's a good exercise right there. All right, now turn on your stomach. Now we can do back extensions. I'm going back to the back now again, but so back extensions. You want to protect the feet there, and you want to come up and back. Keep going up, up. Back extensions, good. Now hold on to the floor with both hands. Raise up one arm, right arm and left leg. Bird dog on the ball. Bird dog on the ball. See this? That's another thing you can do. Okay? Is that good? Okay, now stand up. Let's do the rotator cuff. We're almost
Side to
done.
side crunches with and without the bars.
I'm sorry.
Side to side crunches with and without the bar.
Do it. What do you mean? Which
If you're sitting on the ball
Yeah.
and then you do the side to side crunches,
one? Do it.
and
You know
then
what I'm talking about?
to add weight to it, you add one of the bars.
With the bar.
Oh.
Like this?
You sit on the ball
With the bar.
and then you just do a side to side crunch.
Like this?
Yeah, and then
Okay.
to add weight, you
Okay.
add one of the
Oh,
bars.
Okay.
Yeah.
And by the way, take this ball away for a second. We can also do obliques here. I didn't show you another thing. I need you to put your legs here. Lean back on the ball. Slide down just a little bit. Slide down. Keep down. Lean back. Turn. Okay, now put your head back. We can do sit-ups on the ball this way, straight up. Don't bend your neck. Now bring your legs to the side. Turn your body to the right. That's good. Now come up and do obliques. Okay, now you can come over the ball a little bit more. Now sit on the ball.
Sit on ball?
Yeah, and then come back with your head back. Protect your head. Go on the floor. Lean back all the way.
Oh.
Okay, now sit-ups. Head straight. She's bending her neck. Always no good. Now, always keep your chin pointing to the ceiling. Have them look at the ceiling. Watch their eyes. If their eyes come forward, that means they're cheating. Bring your knees together. Pull your legs to the left. No, pull your legs to the left. No, stay back. Stay back. Okay, bring your knees together. Up. See, that's hard, right? So
Oh,
we're
yes.
stabilizing. Okay, so now we're going to get obliques, right? All right, that's not easy to do, is it?
What
Okay.
about the thin flip over?
Yeah,
Black side.
that's
That's too
yeah, that's
advanced.
fine.
Just
Okay, let's move this away. Rotator cuff. Okay, so rotator cuff is a small muscle in the shoulder. Stand over here. So we're going to do two ways of doing it. We're going to do it with the band. Elbow stay straight. Elbow straight. You're going to pull it out to the side. Notice how far I'm going. This is just the abduction. Don't turn the wrist. Elbow stay straight. Elbow stay straight. Abduction. Don't twist the arm and all this other nonsense. Okay, next one is external rotation. So if you want to put a pillow here, if the pillow falls to the ground, that means they're cheating. So they keep their wrist straight, pull out. What's going to happen to people when they do this is they're going to drop their arm like this. They're going to come down like this. See what I'm doing here? That's cheating. That's cheating. So elbow has to be 90 degrees, 90, 90. Wrist doesn't do this kind of stuff with the wrist, okay? And don't turn the body like that because that's cheating too, right? All right? Next one is going to be extension. Okay, so we're going to do extension. That's this way. You got it? And then face me. Then we do flexion. And when we do flexion, we just come up this way. It's like an oil can, right? Got it? All right? And then you can do internal rotation. Now that's the one you do the least. This one you do only a few times. You don't have to do this one a lot. Internal rotation. You got it? Internal rotation. Now let's make believe that the patient. Can you stand up? We're going to put her on the table here. Where's the here's the weight. Now let's say you're going to do. Put your face the window. Face the window. Well, let's say she's got a left shoulder problem. You want to do that? I say do it with weights. So if you do it with weights, so abduction is you're going to hold the shoulder here, and she's going to come up this way. Now, elbow straight. Notice where it's behind the back. See how straight that is? Okay. The next one is external rotation. You put this on their stomach. The weight comes forward, and you lift up like that. So external rotation. Don't cheat. Now you keep them in this line. You see how I'm protecting? She's already going down. You see how she's cheating? You got to stay in this line. See how this is? So what they're going to do is they're going to come here because it's easier. And they're going to lean back the shoulder like that. Okay, so that's why you got to stay with it. You feel that?
Yeah.
That's not easy to do.
Nope.
Okay? All right? And then she can do on her back, face up. She can do flexion. Okay? She can do diagonal patterns this way. She can do diagonal pattern from this side across. Those are P and F patterns. She can do external and internal rotation this way. She can do external, internal rotation this way. Right? Now line your stomach. She can also do external, internal rotation this way. Up and back. See?